I will be speaking about advanced directives and advanced care planning. Advanced care planning is the process of considering your medical choices and sharing them with people in your life. You're making decisions for a time that you may not be able to speak for yourself. In this situation, the goal is to get what you want in a time where you may not be in the driver's seat. In the words of Sun Tzu, in the art of war, know yourself, know your opponent. Advanced directives are the documents. Advanced care planning, the process. There are two types of advanced directives, healthcare proxy and a living will. The healthcare proxy permits you to identify someone to be your decision maker, your spokesperson. The living will permits you to document what you would want done if you were in a persistent vegetative state or you were in a terminal condition. So I signed these documents with my attorney. Yeah, right? In a word, no. Sun Tzu speaks about knowing your playing field. The advanced directive documents represent your choices, but there should be more to the process than just signing a piece of paper. Though the advanced care planning, it's more like, it should be like a waltz, but that every dancer knows its steps, every doctor knows what to do, every nurse knows what you've said. It's actually more like a mosh pit. There's no formal process. So often I hear from patients, my family knows my wishes. Lack of awareness and understanding, both by healthcare professionals and the patient, contributes to a 26% completion rate nationally. So currently the process is the blind leading a group when the topic's brought up, it kind of looks like this. 70% of Americans die of chronic disease, my mother being one of them. My mother died of a chronic breathing problem called COPD. The year before she died, she was seen in the ER about 12 times and hospitalized about 5. She referred to her hospitalizations as vacations. I thought the whole family knew she was dying. I sure did. They saw this as, this was Linda. Family just got used to her complaining and not being able to breathe, and they just expected this is not going to kill her. It's just a minor setback. My mother, like most Americans, just assumed everyone knew what she wanted, especially my aunt, her forever friend. She had spoken with her doctors. She had a do not resuscitate order, and an order not to put a breathing tube in, so no CPR, no breathing tube. Do not intubate is the other order. Perhaps if I used the strategies illustrating the art of war, my mother's end of life would not have been what it was. My aunt knew nothing of my conversation with my mother and ordered the physician to perform CPR on her. She thought she was helping. She didn't know what to do. Perhaps the subject needs reframing. Patients expect the healthcare professionals to bring up the subject when the time is right. We live in a world of fragmented medical care. At end of life, many patients are seeing over 10 doctors. Instead of leaving the process to chance, perhaps it's time for the patient to take an active role in their care. Perhaps we need to be our own advocates. The advanced care planning process should include a discussion. Here is where you appoint your command. Make a list of people you feel would be able to advocate for you, your short list. Call them up for dinner. You have a captive audience. Gauge their response to determine who you would like to approach to be your spokesperson. Your spokesperson is your healthcare agent. Your second in command, if you will. The alternative healthcare agent, this is the person who steps in if the healthcare agent is unwilling or unable to make those decisions for you for whatever reason. Don't just share your wishes with your short list, however. Remember, the process is fragmented. Oftentimes, the emergency contact is mistaken for the healthcare agent. Have this discussion with everyone that will come out of the woodwork when you are ill. In sum, we need to make a plan. We need to move beyond just the estate planning and discuss that you have the discussion in your lawyer's office. Remember, after all it is said and done, you can't talk to a piece of paper. Share your plans, your choices with the people that will be with you during your journey. A dialogue provides opportunity to ask questions. Invoke the help of the medical team so you are educated about your medical decisions. Be prepared. Compile documents. Make lists and distribute copies to at least your short list via email and print. Don't just leave it to chance. List your medications, your allergies, your medical history. A copy of your advanced directives as well. Distribute, update, and redistribute as necessary. I often say distribute them at, like, you know how you change the light bulb in your, change the batteries in your alarms? Your fire alarm? Same thing. Consider meeting with a financial professional and a legal professional to address other needs.